Hello and welcome to your program. This is SOUQ Pulse, and by now you know where we are already. We don't need to argue about that or even think it. This is SOUQ News, where we tell you and you know we are all about positivities. So get here, get informed, get detoxed, and get the solution to start that business. Get that information you need to ginger up and tell yourself we can get it done. Now, on SOUQ Pulse, for those that are not aware, this happens to be the last day of September. We are heading into the last 3 months of 2024. So congratulations, you made it. Congratulations once again, because you have work before you. So every of that goal you set at the beginning of the year, you still have 3 months to achieve it. So don't fret. Don't give up. You've got strength. You've got life in you. So, hey, get out there and let's achieve it. And while we are trying our best to achieve it, we will talk. We will not keep quiet, because this is SOUQ Pulse. So get around, call your friends, your neighbors. It's time to talk. Today we are heading somewhere that affects every single one of us. Information that a lot of people might not be aware of. We'll try to find out if we are actually committing a crime. It's possible. But before we get there, hope you know, because it's enshrined right now, it's all about productivity. That's what we do on SOUQ Pulse. So we want to get productive, and so we matter. You matter. We've got a very short break. When we return, I'm going to introduce the main topic and my guest. So don't get scared. My name is SOUQ, John Rogers SOUQ. SOUQ Pulse will be right here. Don't go anywhere. Welcome back. This is SOUQ Pulse, and today we are going to the health sector. Yes. Now, aside the health sector, we are looking at insurance. So, health insurance, basic health insurance for a nation, for a people to be productive. Then they have to be healthy. And there's one thing you know for sure, that if you know at the back of your mind that there is a backing, so I get there, I work. If I fall sick, I know where to get to. I don't need the cash in my pocket, because something somewhere has been put aside and I can get attended to. It doesn't matter how small or how big. They know that, yes, a people and a nation will thrive. Now, let me break it further. For those that are not aware, let me talk to Nigerians right now. Sometime in May 19th, 2022, the National Health Insurance Authority bill was signed into law. I had to close my eye, because I think at the point of time I even forgot about it completely. Now, if this bill was signed into law, let me tell you what it says. It's mandatory for every Nigerian and legal resident in Nigeria to have health insurance. Now, I'm going to find out if we have all been living a crime. So don't go anywhere. Just stay there. To do justice to this particular topic is no other but a public analyst of repute. Someone that has gone ahead not just to train Nigerians, but to train Africans, and he is good at it. Your Excellencies, distinguished ladies and gentlemen, join me as I welcome to SOUQ Pulse for the last day of September, Mr. Sam Orovwuje. You're welcome, sir.
Good afternoon, SOUQ.
Thank you very much. So let's start this way. There are over 200 million Nigerians. We've had that 200 million for a very long time. Now, with over 80% of this population active, working, engaged, or they can't get active, they can't get working, they can't get engaged. So whether you have a job or you don't have a job, whether you're farming or you're not farming. Now, let's ask ourselves, are they aware that there is this bill that has been signed 2 years and some months ago?
Well, the health insurance policy document was signed into law sometime in May 2022, which is a framework, a policy framework that caters for the insurance scheme of Nigerian citizens. So within that framework, it's advisable that public sector organizations and private sector organizations.
Sorry, are you saying it's advisable?
Yes, because the policy framework is there, but if you look at the number of enrollees into that scheme as we speak, is a far cry from the expectation of that policy framework that was put in place in 2022 to cater for the insurance health needs of Nigerians. So in that regard, that's why I said it's advisable that most public sector organizations and private sector organizations were supposed to enroll into this insurance scheme with a minimum threshold of certain amount of money that you pay. Once you pay that, that means you have a health insurance cover where you can access a Medicare. And you have organizations that are registered called the HMOs, which means Health Maintenance Organizations, who are service provider, who are the middleman, if you like, between the insurance provider and the enrollee, who has insurance cover from various private sector hospital and public sector facilities.
Okay. Now, you've looked at it from the side of those that are gainfully employed, those within organizations, those within agencies. But now the bill states that it is mandatory for all citizens, in capital letter, all citizens and legal residents. This is where I was looking at it. The productivity of any nation is well hinged on how healthy that nation is, health-wise, body-wise. Now, if somebody says, okay, good, we want Nigerians to be healthy and get to work, did they really tinker up this particular bill, or is the bill coming too early? Now, before we get to that particular question, who exactly is going to pay if they say all citizens, all legal residents? Who pays?
No, once you say mandatory, that is by law, every citizen that reside within the geographical area called Nigeria was, by implication, was supposed to be an enrollee, a subscriber to the health insurance scheme. So it behoves on companies, public sector organization to enroll the workforce first and foremost for those who are working. But even the percentage of those within the purview of those who are gainfully employed, the number of people that are enrollee,
those that are gainfully employed,
yes, in that scheme is equally a far cry to what the Act stipulates. So the point I'm making is that even where you have organizations that are by law supposed to subscribe to those health insurance schemes, how many companies
are doing it?
That's on the one hand.
Can we go back to this bill itself? Was it well thought out?
The bill is well thought out. The idea is that for every Nigerian citizen, once you have a minimum at the point where it was finally reviewed in 2022, with 500 naira to 1,000 naira, you're supposed to have an insurance scheme that can take care of that individual.
Therefore, 500 naira or 1,000 naira?
No, between 500 and 1,000. Maybe when that
basic.
Yeah, minimum threshold.
Minimum threshold.
When it was reviewed in 2022, I think the minimum threshold was 1,000 naira. So once
minimum threshold of 1,000 naira.
Yes. Once you have 1,000 naira given to an HMO, health maintenance organization, therefore you have access to basic Medicare from any hospital of your choice, depending on the service provider, which hospitals fall within their purview. So within that 1,000 naira, and you can get basic Medicare.
Basic Medicare. I like to use the word
basic, yes.
I will now bring back that basic to the citizens.
Surgeries and some other things like dental, like eye care, ears and other Medicare that are slightly
elitist,
higher, not necessarily elitist, higher than the level of the money that you have paid in terms of subscription to an HMO to provide that health insurance scheme.
Okay, now let's go back to this population figure again. Over 200. Now let's break it down. What is killing Africans the most? It's not war, it's not hunger, it's not HIV, it's not cancer, it's malaria. A drug that you can't get for less than 500, 600, 1,000 naira. Now, if people know that this is this law, because it's a law right now, and they can just go and register in an HMO for 1,000 naira. If they have malaria along the line, whether they have a job or not, that death rate should be cut by at least 80%.
I think the issue here is rather of education, the advocacy to educate more Nigerians.
Who should do that?
Number one, there's a federal government agency that is responsible for health insurance. So first and foremost, they have the responsibility to provide education, particularly for public sector workers. But I do know for practice.
If we keep looking at those that are gainfully employed,
just
who informs or who takes care of those that don't even have a
Let's
job?
take care of those who are even first and foremost gainfully employed.
Okay.
Who has a kind of mandatory requirement by law. The public sector, who is a driver of this law, first and foremost, they should take care of that sector. What is the number of public sector people who are subscribing to the health insurance scheme? On the other hand, the private sector companies, by HRO practice and by law, are supposed to enroll their staff into that insurance scheme. But again, beyond the minimum threshold, different company has a different policy in place that take care of different categories of their management, maybe from supervisory grade to managerial grade to senior management grade and to the executive committee grade, depending on the policy that is in place. Various enrollees will now have a package. The limits and the extension to that package will be determined by the policy of individual companies that are subscribing to that particular health insurance scheme.
Okay. Now, let's now go to those that are gainfully employed. You've dwelt there a bit. Let's now look at them. Now, do we have like a collaboration worked out between the health giver, I mean, doctors, every other personnel working in that sector, the health providers, the institution itself, hospitals, pharmacy, every one of them, the insurance companies, government agencies? Do we have that collaboration where the chain itself works swiftly?
There's a structure in place, and to a very large extent, a lot of big corporations, particularly private sector companies, already subscribe to that scheme. Depending, like I mentioned, depending on the health policy framework of that particular organization, general staff, supervisory, middle management, senior management, executive committee. So they have different elements of the categories of which their staff can enroll in those schemes. Then you have the health insurance maintenance company called the HMO, who are intermediary between the insuring company, health insurance company, and the health giver, that's the hospital. So there's a value chain that currently exists in that sector that take care of everybody. So you go to the HMO, you enroll in a particular hospital or it's a health center. So once you do that, your informations are passing there. And at the end of the day, the hospital is paid based on the commitment that is made on the number of enrollees that they have on their register. On the other hand, too, even the public sector has some limitation in terms of what you can assess in terms of healthcare. So if you have certain ailments, the scheme doesn't cover certain age. Even as a private enrollee,
based on what you pay for.
Yes. In addition to that, the scheme itself, there are certain elements that what you pay cannot cover. Therefore, you need to do a premium scheme to be able to cover surgery, some other ailments that are not usually covered in terms of the drug regime. But just like in normal insurance, the same principles apply for the health insurance scheme. So if you have an enrollee from a particular company, maybe 200, maybe only 3 people will access that facility in a year. So just like normal business of insurance that you don't profit from, just bring you to a place of comfort. Same principles apply in the health insurance scheme. Therefore, maybe you have an enrollee of 200, like I mentioned earlier, in a company. Maybe 5 to 10 people may access that facility depending on the categories of your subscription that your HMO provider gives to the hospital, who is your caregiver.
Okay, let's look at this. Let's look at this now. The health insurance. Why are people not logging into it? Why do Nigerians, let me be specific, why are they not aware to this extent? Or why are they just looking at it and standing aloof? Are they seeing it as an elitist kind of scheme, or are they just seeing that, okay, we don't subscribe to this? If we are sick, we'll go take care of ourselves?
No, I think the challenge here generally about insurance is a practice.
Or is it the name insurance?
Yes, once you have the concept of insurance, you have some limitation the way insurance evolve as a business in Nigeria, particularly for motor insurance, where you had clerks selling insurance policy to various insuring public. And at the end of the day, when there was a need for claim, people could not access those claims. So there's this perception, negative perception of the insurance business in Nigeria. And I think it's the same perception that have dovetailed into the health insurance policy. Why not make an excuse? So it's the responsibility of the Nigeria Insurance Association and the National Insurance Commission to provide adequate education on this policy framework that benefits every Nigerian. And to assess that facility is so minimal to a very large extent that if you pay 1,000 naira, then you're able to have some level of healthcare maintenance based on that small premium of 1,000 naira that you pay to your HMO provider, as the case might be. So education is critical. Then Nigerians themselves need to change their mindset when you come to the concept of insurance in itself. And there's this popular saying that God is my insurance. Therefore, I don't need to take an insurance policy. So the appeal here, or the advocacy for this kind of program is to say that while God is your insurance, you equally need some level of health care before God take care of you. So in case you have been bitten by a mosquito and there's a malaria, you can take care of yourself.
Okay.
So it's education, and we need to remove this perception, the public perception, particularly about insurance as a business or as a concept, so that people can get into that scheme, and we have more enrollee. A more robust insurance scheme will help to make the nation to be productive.
Okay, while the nation gets productive and while we get educated and learn more about health insurance and some of those particular questions we are yearning for answers, let's look at the telecom industry. Now, at a particular point in time, when you recharge to a particular limit, you get some SMS. I won't call names of those companies right now. And they'll tell you that, okay, good, for you to have done this amount this month, you get insurance, health insurance to this tune. That kept coming for a while till it stopped. I don't know if people still get it now. What role can telecommunication companies within Africa play? Because almost every communicating African has a phone.
So simply put, what those agencies that are responsible for the promotion of health insurance should do is to collaborate or partner with telecommunication companies in terms of providing information to the public, highlighting the importance of health insurance, the benefits of those schemes, whether you're in the private or public sector. Once that is done, that will improve on the number of enrollee, as it's called, or subscriber to the health insurance policy.
Okay, now let's talk about this aspect. I know some other people out there, you're watching and you're saying, I'm not covered in all this statement that has been made. So, sir, let me ask you this question. Now, who covers the unemployed or the person that can afford it?
Oh, some countries, particularly, let me mention a country. So the countries who are not, you're not going to give me an invoice for mentioning, like Rwanda, for example, which is a case in point. What they do, there's a family or community participation where those who don't have the means to take an insurance policy, relations, enroll them into that scheme. So we can borrow leave from the Rwandan example where at a family level, those who cannot afford to pay that minimum distance, family and relations are able to assist so that they can pull them into that scheme. And that again, we help the families in terms of the kind of family pressure health can bring to bear on some family member from time to time.
Okay, let's now talk for those that are employed. What percentage of contribution is expected from the staff and what percentage is expected from the organization? Or is it just a one-sided, the staff pay or the organization pays?
I'm not too sure because there are a few changes in that policy framework. So I don't want to make an assumption whether an aspect is covered by the employee and the employer. But I will just make a general statement that once you subscribe through an HMO, then depending on the value that is placed on you, depending on the cadre of management that you belong to, then management pay in some cases on behalf of the staff. But I'm not too sure of that new element when that policy was tinkered with in 2022, because that policy was there. It was just improved upon in 2022 when it was now made mandatory. So I cannot speak specifically so that I don't misinform the public. But what I know is that if you belong to an organization, some people pay certain amount to be able to enter into that service delivery. So the percentage for now, I don't know, but you make a payment for that. So different categories, and I'm sure sometimes companies absorb some part of the payment. Some is deducted from your payroll at the end of the day. But when you look at the amount that you pay vis-a-vis the insurance cover that you get to secure your health, I think is just a fraction in terms of what is contributed. So like I mentioned, that company must take it upon themselves to enroll their employees, even where some money may be taken from those employees just to guarantee their health, to enhance their productivity in the workplace, and above all, national productivity.
So we have developing nations. And a lot of developing nations in Africa, their health budget compared to the percentage of their entire budget is less than 5%. With a bill like this that mandates every citizen to be covered with health insurance, how possible is it to achieve this?
Well, the facilities are beyond public facility. So you have public sector facilities in terms of hospital and healthcare centers. On the other hand, you have private sector companies that provide health services. Therefore, you cannot relate this policy vis-a-vis the entire budget, health budget. The health budget is a major challenge. The global benchmark for health education was still a far cry as a country to those minimum benchmark for health in particular and education. But what is important is that once you are able to provide basic insurance cover,
insurance cover for the
citizens,
for the population that we are looking at, the teeming population we're looking at. Example, our country, Nigeria, the health facilities are stretched, both government health facilities the private health facilities are also stretched. Now, for some other health facilities that are private, the ordinary person
You
cannot
must
afford
understand
them.
the concept of insurance first and foremost.
We are
When
looking
the
at
facilities,
that
just a
particular
moment, you need to understand the fundamentals, the
Okay.
framework.
Okay.
If you don't take it from that perspective, it becomes a problem. Everybody cannot fall sick at the same time.
100% agreed.
So therefore, the idea of this scheme is that when you have health challenges, without minimum contribution, you can access a facility to have a basic health care. So let's take it fundamentally from that point.
From the statistics of our health issue in Africa for a while, everybody cannot fall ill at the same time, 100% agree. But as we speak, the health sector cannot cater for those that are sick now, both from the villages down to the urban centers. Now, we have a lot of private health facilities, but can the poor afford them? The government
are
facilities
able to afford
stretched.
The poor are able to afford private facilities once you subscribe to that minimum payment of a health insurance premium. Once it's paid and you have an HMO provider
that will the private sector, from the private
you can
hospitals.
access. Yes, you can access.
To what extent will the private hospital attend to the poor?
No, they will attend to them once you are on the register.
Insurance.
Once you're on that register, that you are registered with a particular hospital facility, it behoves on that hospital to give you basic care.
On paper.
No, once you have an enrollee, once you go to a particular hospital, once you bring your card.
Yes, then we've seen this happen over and over again, where someone comes with a health insurance registration, and you are told, get in touch with your HMO before we attend to you.
No, that's not the case. The point is, once you have a registration in a particular health facility, that health facility is bound to give you treatment. So when they call, they ask you to call your HMO. The point is that the category of service that you have been enrolled into is threatened based on the kind of Medicare that you want to access. Therefore,
is it going to be based on the kind of Medicare or based on the standard of the hospital?
Not the standard of the hospital. For example, you have an enrollment, for example, a figure of 2,000 naira. And you are taken into the hospital, maybe you have an accident, and that hospital does not take care of surgery. Therefore, it behoves on the hospital management to seek a further clearance, whether there's an upgrade for that particular patient, whether inpatient or outpatient, as the case might be, to see if there's a framework, because they have that already in their system, and policy change from time to time. It may have increased something that you couldn't access. They are now accessible. So they don't dismiss you on the basis of the fact that you have an HMO card or an insurance registration number with that particular hospital. They must treat you. So if they reject you, there are laws within the that act that safeguards the patient rights.
Oh, okay. But yes. Do you agree with me that if this comes to fruition and a lot of people are aware of this, we will have more inpatients. We'll have more people accessing health facilities, not just self-medicating.
No, the point I said is that you must get that fundamentally.
Yeah, but if
the number will increase, but not everybody attend a particular facility at a particular point in time.
Yes, I agree with you. Now, you go to some particular locations, you go to some particular villages, some particular local governments. There is one major hospital in a local government. Some local government might not even have one. They all access healthcare in maybe the urban centers. Now, if we get to a point where 50 or 40% of them are covered in this scheme, do we as nations in Africa, have we propped up our health facilities to cater for people that will come in and access healthcare through this insurance means?
Okay, from a business perspective, once the number of enrollee improves, there are certain level of investment that people will make to take advantage of that industry. So, for example, medical doctors who want to go into private practice, want to build hospitals, where they see the statistics from service provider.
But
I'm just saying,
statistics are there already.
No. People make investment from time to time based on research. And that is not peculiar to only healthcare. So I'm saying that people constantly, even in Lagos in the last 20 years, there are certain investments that have been made in the healthcare sector. Some care that used to go to India for medical tourism, they do them within Lagos. So those facilities...
The person going to India for medical tourism is rich.
No, just a moment.
Okay.
Sometimes some of these services were not provided within Nigeria at a particular point in time. But people have made research that some health insurance schemes are valuable to Nigerians. Therefore, let's bring this kind of Medicare closer to the people so that they can take advantage of that policy framework. And as a business, they provide that service to people. So I don't want to mention a particular name, but there was a particular hospital from India who wanted to make a massive investment in Nigeria in terms of setting up various care centers with different kinds of ailments, maybe cancer centers, diabetic centers, and all that. Taking advantage of some of these information that you talk about. So the point I'm making is that the facilities may be overstressed as we speak.
The personnel?
The personnel may be, but new investment in those areas will create new level of personnel that will come to work in those sectors.
Talking about the new investment you're looking at, we are signatory to several sustainable development goals, both that in health. And for this major organization, the World Health Organization, they have said over and over again that developing African nations need 58, simplified side of it, $58 per citizen by 2030 to be able to shore up their health sector. Now, it got me thinking, if we say $58 per citizen, both rich, both poor, but not there, and we multiply that by 200 million, that gets us almost our entire budget of the entire year. Now, we might not also follow that, but we as a people, we African nations, what exactly are we putting in place to make sure that our own citizens are catered for?
Well, there are two levels to this, your question. Number one, while we respect the projection from the World Health Organization in terms of requirement per citizen, particularly in the developing country, they are only looking at Western medicine as a means of taking care of insurance issues. But then we have natural medicines,
okay,
what we prefer to call alternative medicine. It's not alternative, it's natural to our environment. So this population, this health insurance that you talk about, you've not taken cognizance of those who patronize or who should have access to Medicare for natural medicine, which they have access to. So the policy framework equally take care of natural medicine. So
is it going to take care of, or is taking care of already?
Should take care of. Should, yes.
Okay.
But again, to what extent do people have the requisite education to take advantage of that sector?
Okay.
And I'm sure
you brought this,
familiar with that.
You brought this up, so let me ask this so that
you're familiar with this.
I need you to add this to this statement now. Yes. Okay. To what extent can we say, okay, if you are in a place to say, okay, let's advise, let's talk, to what extent do we say, okay, let's integrate natural medicine into this particular scheme so that they can also come up and show up the numbers for health givers?
Absolutely. That's the point I'm trying to make. The point is that those policy framework must be seen to be taking cognizance of all the elements of the health insurance law, to take cognizance of those who provide natural medicine. Therefore, those natural medicine provider HMO should equally enroll people who have the tendency to patronize natural medicine.
Should it be people who have the tendency?
Yeah, what I mean tendency is that because of our sociology of taking what is Western, that the calibrations from the Western medicines are more standardized than the natural medicines that our forefather and our parents are used to. Therefore, there's even an agency of government that is regulating the practice and making development in that sector to be able to regulate it and look at all the medicinal plants that are available. So for healthcare, we must look inward as well to see how natural medicine can equally take advantage of that. So take China in particular, the alternative medicine, as they call it, has been integrated into a Western medical practice. So you have people who operate within the alternative medicine regime, and people have health insurance, and they're able to assess those kind of practitioners in those environments.
Okay, let's look at identification now. From the aspect of this bill, it's gone beyond a bill. This law, do you think identification has any issue, or can it hamper or tamper with this particular law?
What do you mean by identification?
Identification. He is Nigerian, he's not Nigerian. He is a legal resident, he's not a legal resident. Okay, I can identify him as this person from this place or from that place.
No, the point is the issue of identity is not very important. What the law says is that every Nigerian citizen.
So now, how do you how do you find out every Nigerian
there are
citizen?
other levels of non-Nigerians who are gainfully employed, who are gainfully employed into private practice, work for various organizations, based on the fact that they are providing services to a particular organization. They will be enrolled into that scheme as long as they can pay.
That those falls within the category of legal residents.
Yes.
Okay.
So the law does not exclude anybody. What the law says as a minimum threshold, every Nigerian citizen should be enrolled into that scheme. So once you are a Nigerian citizen, ordinarily it should be compulsory that you should be enrolled into that scheme. So, but if you are not able to enroll into that scheme, there are other levels between the public sector and the private sector I mentioned earlier, who find a way to get into an HMO, who is an intermediary between a hospital facility provider or health service provider and the insurance company. So once you pay your premium, then you are covered. Okay.
Now, with this law, because that's what we're going to call it now, with this
law, it's been gazetted since 2022.
2022.
So, yeah, so it's a law.
2 years and 4 months away, or 2 years plus.
More than that.
2 years.
It came into law May 2022. So by May 2023.
2 years, 4 months.
Yes. So
good.
Is a law already officially gazetted.
Okay.
There is a scheme, an agency of government that is responsible.
Okay.
In addition, even to the National Insurance Commission that has an umbrella responsibility for insurance in Nigeria.
Okay. So I had to call that duration from when it was signed into law and
already
today.
Gazetted.
Good. 2 years.
So don't even talking about signing into law. Once a law has been gazetted, it's already an operative law that should guide every citizen.
2 years, 4 months. Now let me get to where I'm saying 2 years, 4 months. I'm not enrolled yet. My family is enrolled. So I might be a bit covered. But me, for one, I'm not enrolled. So there are several people also that are not enrolled. Am I committing a crime?
Yes, by law, you are supposed to have been enrolled. But then I don't see why you are not enrolled. Number one, hold on.
Okay.
Beyond an organization or a company or a public sector agency paying for you, there are schemes that you can subscribe to as an individual to be an enrollee.
Okay.
So therefore, you can walk into any HMO and look at the various classification of the schemes that they provide, and you can enroll as an individual. Just the same way you have the pension contributory scheme. You can make contribution as a corporate entity. You make some contribution as somebody working within the organization. You can still make your individual contribution beyond the mandatory element that your company pays on your behalf and you pay on your behalf. So if you have additional money, you can make an individual contribution. Same way, the insurance scheme, individuals you enroll based on your capacity to access a health facility.
Okay, based on my capacity. Good. So 2 years, 4 months, I've been committing a crime. Now let's still go back to this 2 years.
I didn't say so.
Let's still go back to this 2 years, 4 months. Now, in this period, this particular law have not worked well. Implementation has been an issue. What can be done to make sure that Nigerians and lawful, legal citizens and residents get to not just know, but sign on to this particular scheme?
So the agency that is responsible for health insurance has the responsibility to educate the public, particularly the public sector, and see how they can enforce those elements in public sector. No public sector organization should be left out in that scheme. That's number one. Number two, they need to provide additional advocacy in terms of education to the general public on the importance of enrolling or paying subscription to access insurance cover, at least some level of health insurance. Number three, the HMO have a responsibility, again, to educate the public. So the advocacy can be going from school to school, from a marketplace to another marketplace, providing education on the importance, and saying that with a minimum or a little money, maybe between 1,000 and 2,000 naira that you put away, you can subscribe to a health facility to a certain level of service provision from a hospital or a health caregiver facility that can take care of you. So education is critical to scaling up the number of enrollees that can take advantage of the health insurance scheme, as the law prescribes that every citizen should compulsorily be enrolled into that scheme.
Thank you very much, Mr. Sam. It's been our pleasure having you on SOUQ Pulse today.
Thank you.
Good. So we have been schooled, educated, and now we know better. 2 years, 4 months. That's a long time. Now, know this. The health insurance scheme is there. The next person should not die of malaria. It's not expensive. Not the drug itself, but get insured. Like a family, he said something that we can also emulate Rwanda. Sign on your brother that is not working. Sign on your sister or your parents in the village. You can also get them to sign on and use the health facility there in the village. It saves a whole lot. Not at point of emergency, then you start looking for money off the pocket for treatment. It saves a whole lot. And it gets Africa productive. Takes the worry off our heads. To everyone out there, join the conversation. Now argue on your part. Remember, this is SOUQ Pulse. I will tell you, we don't keep quiet. Topical issues, we talk about it. And when it comes to educating ourselves, we humble ourselves and get educated. Thank you very much for being part of the show today. We'll do this again tomorrow. To everyone out there in Nigeria, tomorrow is a very special day. So prepare. Promises to be very special. Have yourself a wonderful evening. My name is SOUQ, John Rogers SOUQ. Remember, love your neighbor as yourself. Bye.